Okay. So today we are going to study about the second part of endocrinology, that is the Cushing syndrome. Right? Can you tell me what is another name of Cushing syndrome? Tell me another name. What is another name of Cushing syndrome? Crisis. You are just saying the opposite one. In case of adrenal crisis, the adrenal gland is going to produce too less, right? And then there is going to be the deficiency of the adrenal hormones. In case of Cushing syndrome, it is going to have high amount of adrenal activity, not less. So just the opposite. Can you tell me another name of? Yeah? Yes, it is the hypercortisolism. Okay, so let's begin to talk about this disease. We call it Cushing syndrome, or as your friend told, we can even call it hypercortisolism. Right, hypercortisolism. So you people already know that in our body we have got adrenal gland, and we have got two adrenal glands just sitting above our kidney. The right adrenal gland is triangular in shape, while the left one is semilunar in shape. And you know that in our body we have got the hypothalamus, pituitary and adrenal axis, right? It means the hypothalamus is going to produce one hormone, we call it the CRH, right? And the pituitary, in response to the CRH, is going to produce one hormone, we call it ACTH. And then in response to the ACTH, the adrenal gland is going to produce one hormone, in fact many hormones, and one of the very important hormone is the cortisol. And this axis is called as the hypothalamic pituitary adrenal axis, right? So by the name it's very clear, the patient is having hypercortisolism, means there is more amount of cortisol in the body. So first of all, let's try to find out that what thing can cause the situation when there is more cortisol in our body. So let's try to find out the etiology, the causes of the hypercortisolism. And while we are talking about the etiology, I would like you people to make one table for it, and in this table we'll try to see different causes, and along with that we'll try to see what is going to happen to the level of ACTH. Give me the full form of ACTH. Adrenocorticotropic hormone produced by the pituitary. So we'll try to even see that what is the situation going on for the ACTH, and then we'd also like to see that what is happening to the person's adrenal gland, right? What is happening to the person's adrenal gland, whether the size is increasing or decreasing, what is the problem going on, what is the situation going on. So we'll try to see these things, and mainly we are going to talk about the etiology here. So now, first of all, keep in mind, if we are thinking about the hypercortisolism, the most common cause of hypercortisolism in the world is the application of exogenous, right, glucocorticoid. You know that there are so many diseases for which we need to use the glucocorticoids, the steroids. And whenever we use a steroid for the patient can develop, if it is high dose and for the long duration, then the patient can develop high cortisol in the body, and they are going to have the hypercortisolism, right? So this kind of etiology, we simply call it exogenous glucocorticoids. Now keep in mind, never to forget that this is the most common cause of hypercortisolism in the world. This is the most common cause for the Cushing syndrome in the world. And you can imagine, all of you try to understand this phenomena. Suppose that I am drawing your hypothalamus is here. Suppose that this is your hypothalamus. And we know that hypothalamus is going to release one very important hormone, what do you call it? CRH, right? Corticotropic releasing hormone. And on the response of this, the pituitary gland is going to produce, right, in response to this, the pituitary gland is going to produce one of the very important hormone, we call it ACTH, right? Adrenocorticotropic hormone, we call it ACTH. Now I want people to know one very important thing, that whenever the CRH is released by the hypothalamus, then the pituitary gland is going to produce the ACTH, but in the beginning the ACTH, the precursor of the ACTH in the pituitary gland is going to be something called as I want all of you to write this name, pro-opio, right, write this name down, pro-opio-melanocortin. Pro-opio-melanocortin. We simply call it the POMC. pro-opiomelanocortins, right? We call it POMC. So all of you don't understand this thing. Whenever the hypothalamus is stimulated, then it is going to release the chronotropic releasing hormone. This chronotropic releasing hormone is going to stimulate the pituitary to produce one precursor. What do you call this precursor? POMC, right? So we call it the pro-opiomelanocortins. Now keep in mind that this POMC very quickly is going to convert into many different kind of hormones in the pituitary gland. But right now, today, we are mainly concerned about one very important, what is that? ACTH. But don't forget that the POMC is the precursor even for another hormone, and this hormone is going to be called as MSH. Give me the full form. Melanocyte stimulating hormone. And you already know, by the name it's very clear, melanocyte stimulating hormone means this is going to stimulate your melanocytes in your body, right? And why I'm talking about this particular thing here, this phenomena right now, why I'm talking about the POMC, and many times the students are confused that in which situation of the Cushing syndrome, the patient will come to you with the hyperpigmentation, and what is the cause of hyperpigmentation. So if you understand at this moment, then it will be easy for you later on. So once again, let's repeat. Hypothalamus got stimulated, it produced which hormone? CRH. It stimulated the pituitary to produce one precursor, what do you call it? POMC. Give me the full form. Pro-opiomelanocortins. And they are mainly going to produce the ACTH. They are going to be converted to ACTH. At the same time, they also can be converted to which one? MSH. Right? Now keep in mind, when this ACTH goes to your adrenal gland, and you already know that you have got two adrenal glands just sitting above your kidneys. The right one is triangular in shape. And if we talk about the left one is going to be which in shape? Semicircular. So your right and the left adrenal gland are not of the same shape. They are having the same histology, but the shape is not same. The right one is triangular, while the left one is going to have the semicircular shape. Now go further here. In case of the ACTH released by the pituitary gland, when this ACTH will act upon the your adrenal gland, and in your adrenal gland, we have divided the adrenal gland into two categories mainly. We call it medulla of the adrenal gland, and then outer part we call it cortex. In the cortex also there are three different layers, right? The outermost is called as glomerulosa, then we call it fasciculata, and then there is reticularis. So this ACTH mainly works in the cortex of the adrenal gland, not in the medulla, mainly in the cortex of the adrenal gland, and mainly in the zona fasciculata, right? And when it is going to act upon the zona fasciculata is going to release huge amount of what? Cortisol. And you know that cortisol is a stress hormone. The another name of the cortisol, we also sometimes call it stress hormone, because this hormone is released whenever your body is under some stress, some mental stress, or even some infectious stress in your body. Whenever your body is attacked by some infectious organs, your body goes through the stress situation and it's going to release lots of cortisol. Clear about this thing? Okay, now keep in mind, the cortisol by many professors, they are also believed as anti-insulin. Their function will also look something like anti-insulin. And what is the meaning? Last class we were learning about the insulin, and we learned that insulin is the one that puts the glucose from the blood to the cells. Means the blood glucose is going to be increased or decreased? Decreased. But the cortisol action is just the opposite. Cortisol is going to increase your blood glucose level. Right? So many books and many professors, they also believe to call the cortisol as anti-insulin. So all this information we'll have this here. Okay, so this one I have just given you some basic idea that how exactly this axis works. Now we'll go back to our etiology, and just now I was giving you the idea. What is the most common cause of Cushing syndrome in the world? Tell me. Exogenous use of high dose long-term glucocorticoids. Right? My question to you, if this patient came to you and this person is taking the glucocorticoid from outside, it's not that his body is producing it. Right? He's taking it from outside. So if this person is having huge amount of ACTH, you tell me, this ACTH will be, if you test the blood of this person, are you going to find more ACTH in the body or less ACTH in the body? Less, because of negative feedback, right? So never forget that this patient is going to have less ACTH in the body, right? And at the same time, you tell me, if the job of your adrenal gland is being done by this exogenous glucocorticoid, it means your adrenal gland has to do more production of cortisol or no production of cortisol? No, it is not doing anything, right? So it will go through the atrophy or it will go through the hypertrophy. Atrophy, and this atrophy will only happen in the right side or left side or bilateral? Bilateral, right? It's going to both sides. So never forget that in this situation you will find that the patient is having bilateral hypertrophy. Bilateral Atrophy. Okay, so it seems only I am sleeping, you people are awake. Okay, so patient is having bilateral atrophy, right? So keep in mind, the most common cause in the world is the exogenous glucocorticoid, and this will be the picture. Whenever patient will come to you, you will find that they are going to have the sign and symptom of the Cushing syndrome. You will simply check the SCTS, you will find it is decreased, and you will check the adrenal gland, and you will find that the both adrenal gland has become atrophied. Then you can say that, okay, maybe patient is having exogenous glucocorticoid intake causing the Cushing syndrome. How to treat it? We try to stop the glucocorticoid. It's so simple. Now the problem that for the medical students is not the exogenous, but the second one, what is that? Endogenous. Endogenous Cushing syndrome. It means your body is producing lots of cortisol, right? So patient is having endogenous Cushing syndrome. Means the body is having some problem to cause the high amount of cortisol in the body. Now this endogenous causes, again we can divide them into many different categories. The most common in the world, in the endogenous, right? If I ask you which is the most common Cushing syndrome in the world, what is your answer? Exogenous. But when we talk about the endogenous, the most common cause of endogenous Cushing syndrome is going to be your pituitary gland getting some kind of adenoma or some pathology in the pituitary gland, and that pathology will make your lots of ACTH, and this patient is going to have increase in the size of the adrenal gland, and the patient is having high amount of production of cortisol, right? And this particular syndrome we are simply going to call it, number one, here you can see in the endogenous is going to be the pituitary pathology, right? The pathology in pituitary. Pituitary pathology. And don't forget, in the endogenous, this is alone, it comprises around 70% of the whole Cushing syndrome, right? Alone, it's going to be around 70% of the whole Cushing syndrome. And keep in mind, the most common cause of pituitary pathology to cause the Cushing syndrome is going to be the pituitary adenoma. And if somebody is having pituitary adenoma, you can imagine the pituitary gland is producing high amount of ACTH. And this ACTH is making your adrenal gland to be larger, and it is producing more and more amount of cortisol. What idea? And don't forget, in the exam you will find one terminology. It is sometimes called as Cushing's disease. So this is one very important thing you people should be very, very careful in the exam. Cushing syndrome is not equal to Cushing disease. What is the most common cause of the Cushing syndrome, you tell me? The exogenous glucocorticoid. And the second cause is the endogenous. In the endogenous, one of the cause I told you where the pituitary gland is producing high amount of ACTH, the pituitary adenoma. And if somebody is having the Cushing syndrome due to the pituitary adenoma, then only we are going to use this terminology. What is that? Cushing's disease. And don't forget, in the endogenous cause, the most common is the Cushing's disease. Okay, so I have a question. All of you tell me, what will happen to the ACTH in the Cushing's disease? Increased. And what will happen to the adrenal gland? Hyperplasia or atrophy? Right, so patient is going to have a unilateral or bilateral? Bilateral. So pituitary gland is going to give this information to both. So patient is going to have the bilateral hypertrophy. Clear about this thing? Bilateral hypertrophy. So this is the number one cause of the endogenous Cushing syndrome. Okay, now very quickly we will go for the second cause. The second most common cause, second most common endogenous cause of the Cushing syndrome is going to be the adrenal pathology. Sometime, independent of the ACTH, your pituitary gland, your adrenal gland will go through some pathology, and your adrenal gland will keep on producing high amount of cortisol without being stimulated by the ACTH. Right? So I'm simply writing that the patient is having adrenal pathology. And don't forget, this alone is going to comprise around 15% of the whole endogenous Cushing syndrome, not the exogenous. We are talking about the endogenous right now. So endogenous Cushing syndrome, the most common is the pituitary adenoma, and the second common is the adrenal pathology. And what adrenal pathology can happen? So there are three very common things that can cause this situation. The first one is simply the bilateral adrenal hyperplasia. This can cause the situation. Sometime the patient can have the adrenal adenoma. Independent of the ACTH from the pituitary gland, it keep on producing the more and more cortisol. And the third one, it could be simply adrenal carcinoma. Right? So these are the three common causes of the adrenal pathology which can cause the Cushing syndrome. And my question to you, you imagine this thing, this adrenal gland without being stimulated, started causing the more and more production of cortisol. So due to the negative feedback from the cortisol, this patient is going to have more ACTH or less ACTH in the body? Less ACTH, right? This cortisol can cause the negative feedback and the person is going to have less ACTH. And not only that, what will happen to the size of the adrenal gland? Will it be increased or decreased? Increased. It is producing more and more cortisol. So now keep in mind, in case of the adrenal pathology, if we look at the size of the adrenal gland, it will depend that what kind of problem patient is having. If the patient is having adrenal carcinoma, imagine this thing. Suppose the patient developed the right adrenal carcinoma. The right adrenal gland is producing lots of cortisol, right? So my question to you, what will happen to the size of the right adrenal gland? It will become larger. And what will happen to the size of the left adrenal gland? It will become smaller, right? So the adrenal gland which is having the pathology, that will become larger. That is the one causing the problem. But the other one which is not having the pathology, that is going to become atrophied, right, by the negative feedback. Right. So what you can imagine that in case of the adrenal size here, if you look at the involved adrenal gland, tell me, will be hypertrophied or atrophied? Hypertrophied. And that adrenal gland which is not involved, that is going to be non-involved gland will be atrophied. Right. The non-involved gland is going to be atrophied. Clear about this thing? And never forget this one very important phenomena. Keep in mind that this cortisol is always going to exhibit the negative feedback on which one? The ACTH. So if there is high amount of cortisol, due to the negative feedback, the ACTH would be normally decreased if everything is normal. And one more knowledge I want to give you here, when there is high amount of cortisol, the negative feedback will not only happen for ACTH, the negative feedback will also happen for another hormone produced by the pituitary gland. There is one more hormone, I think all of you already know, we call it gonadotropic stimulating hormone. Have you heard the name? Gonadotropic stimulating hormone. For example, the FSH, LH, right? So this hormone and the ACTH, they look very similar. The gonadotropic stimulating hormone and the ACTH, they are very, very similar. So when there will be high amount of cortisol, for sure the cortisol is going to do the negative feedback to the ACTH. At the same time, the cortisol also can do the negative feedback to which one? The gonadotropic stimulating hormone. So here you can see, if somebody is having high amount of cortisol in the body, the patient is also going to have less amount of FSH, less amount of LH, and patient may develop some problem in the testis and the ovary. These hormones are also going to be less. So two extra things you have to remember here. All of you try to focus here. Whenever there is high amount of CRH, whenever there is high amount of ACTH, let's say about this thing, whenever your pituitary gland is producing more ACTH, in order to produce the ACTH, it needs first to produce the precursor. And what is the precursor? PUMC. Give me the full form. O for opio, and M for melano, C for cortin. And never forget, when your pituitary gland is producing more and more ACTH, it means it is producing more and more PUMC, and it simply means that there is also going to be an increase in production of what? MSH, and the patient is going to have the hyperpigmentation. So my question to you, in case of the exogenous Cushing syndrome, will the patient suffer the hyperpigmentation? Yes or no? No, because the pituitary gland is not producing ACTH. In case of the endogenous pituitary pathology, let's say very simply Cushing's disease, will there be the hyperpigmentation or not? Yes, right. More ACTH means more PUMC, means